Medical doctor Dr. Chris Reynolds responds to questions about the therapeutic benefits of wheatgrass. My father has had a foot ulcer for a long time. Doctors want to amputate his toe. Can wheatgrass help?
Yes, it certainly can. In most cases, I hate to say all, but certainly in most cases, and certainly all the cases that I've seen. Diabetic foot ulcers relate to the high blood sugars in the system and the effect or the effects that the condition has on these very small blood vessels at the surface of the skin or just under the skin. And we call that the microcirculation. And those little blood vessels, small enough to go to each individual cell, so you can imagine how minute they are, but they're all control the actual blood flow and the oxygen flow, therefore the oxygen and nutritional flow through those blood vessels is controlled by nerves, tiny little nerves that open and close the what would you call it, the caliber of the vessels, these tiny micro vessels, according to the needs of the cells. And when those nerve endings start to be destroyed, those blood vessels lose that control, the blood becomes static, what we call necrosis, in other words death of the tissue, or some of the tissue occurs, especially if there's a bump or a person injures their foot or something like that, treads on a stone or something. There's no healing process, there's no blood left there to heal that damage or to remove the blood clot that's left behind. It can be only a very small amount, and then the skin breaks down and a small ulcer can develop. And that can go on for many, many years. And gradually it gets bigger and it gets deeper. What wheatgrass appears to do, and because when one of these ulcers develops, the base of the ulcer becomes lifeless. It's brown and there's no vascularization or anything like that. And what wheatgrass does, and I've seen this on many occasions, we call these neuropathic ulcers. They're like from the nervous system, cause the pathology. You put I just use a wheatgrass extract, and I put a bit of that just on the floor of the ulcer. You don't need very much. Usually within a week, 10 days, that circulation, you can actually see a return of vitality to the bottom of the ulcer, to the blood supply. And it turns pink. So you know that something's happened. What the extract also does is debride the ulcer. It starts to clean it. And this was observed way back in the 1930s in the United States when they were using it on diabetic foot ulcers. The healing process can't start without that reoxygenation or return of nutrients and oxygen to that tissue. But this is what appears to be happening. And slowly that ulcer fills, and slowly it can happen quite quickly, over 6-8 weeks. And I've had many patients that have had that experience. There are a number of case histories on our website, and we're actually running a study in a specialist diabetic hospital in India, in Chennai, where we have 100 patients with diabetic ulcers. And the reason the hospital is going ahead with this is because they've done about 15, or used the extract in about 15 cases, and these ulcers have all healed. And so they got quite excited about this, and this is how we're now proceeding with that study. And so we're looking forward to the results of that. But as I always say when I'm talking about wheatgrass, I mean, you're dealing with a harmless substance, essentially a harmless substance. Using it on the skin, some people very rarely have a skin reaction, an allergy or something like that, but it's extremely rare. And so it's a safe thing. I mean, wheatgrass is a food, essentially. It comes from wheat. I mean, we eat bread. I mean, it's not hardly a toxic plant. And it's been used for thousands of years in history. It's very used a lot in Ayurvedic medicine in India, has been for thousands of years. That's the way that I approach diabetic ulcers now, and it's saved a lot of patients from amputation, and I'm pretty proud of that. I think going to help a lot of people in future. There's really no treatment for these ulcers. I mean, debriding and but there's nothing that actively reactivates that blood supply, which is critical to their healing. I think it's really quite a breakthrough, and as I say, they were using it in the 1930s, and I'm surprised that it's not still being used. I wasn't aware of that when but there is research to show that it's been recorded that they were using the big hospitals in the United States for diabetic ulcers and getting very good results.
Does wheatgrass minimise the pain, or does it heal the ulcer?
Oh no, they feel they heal. They heal. People avoid amputation. There's a very large percentage of these people go into amputation after a number of years when the doctors can't do anything about it. If it's because what happens is the bone gets infected, say on a toe or something like that, or in the foot. It's called osteomyelitis, and they treat it with antibiotics and things, but sometimes it just doesn't work, and eventually they just have to remove the toe or the digit or part of the foot, sometimes the whole foot. So it's not a matter of the circulation in terms of the arterial circulation. A lot of these patients have good blood supply to their lower limbs, but it's when you get down to those micro vessels. And I think what happens is that what the wheatgrass does, it regenerates, because it regenerates those tiny little nerve endings. I mean, it's got to be doing something like that. We've seen this in leprosy. We did a leprosy study in India as well, and it's a similar type of ulcer, and we had the same response. And I think 60% of those patients actually, their ulcers healed, and some of them have been there for 30 years. So there's something worthwhile looking at there. I don't know what the bioactive is that does it. I wish I did know, but I think there is I'm pretty sure that what the wheatgrass does, it activates growth factors, and those growth factors help to what we call remyelinate, or to reconstruct those tiny nerve endings. They open up the tiny vessels, and then this tissue starts to, cell by cell, starts to regenerate and recover. And it can be quite quick.